you get that. Is it nobler to serve each person completely than to labor diligently for the masses? After all, the masses are usually those who cannot afford the first option. And if you didn't exist, Rick, people would not be treated, right? So your model essentially has to exist, but it cannot be a nonprofit either. So talk to us a little bit about that.
Well, really, it's a question of healthcare. People need access to dental care. You have professional obligation for the best options to all your patients. So we are offering the full option that you would get in any other office. So there's very little difference in treatment presentation. The financial health of the patient will ultimately determine the path. Not every patient can afford everything you believe to be best, but every patient deserves to be able to make that decision. We know that we treat one patient at a time, not the masses. So they might be coming in from some type of affiliation, but everyone is treated in a very unique and personalized manner. So here's my reality. The majority of dental practitioners are working on the others. 68% of patients have some form of dental benefits as of the poll taken in 2019. Concept of boutique practice can be extremely rewarding, but it doesn't come without a distinct set of complications. And that has to do with the volume and consistent volume. There'll always be an exclusive model for everything from healthcare to country club. But reality and statistics prove there are way more, we'll call them consumers, patients, individuals that fit into a well-run business, whether it's a solo practitioner, small group, large group, or a branded DSO office. The size of your office and the distinction of your role will determine what works for you. So for me, I can work in a larger environment. I'm not the hands anymore. I have other people that are working and being very well compensated for their professional help within the practice. They're helping people. And obviously, I keep going back to people. This is not done a lot. It's all about people. It's a question of really the business model. All right, when you're dealing with volume, having physical capacity, example being a larger office, efficient, well-trained doctors, great equipment, larger hygiene program, well-trained admin, management. All of this is necessary to provide dental care at scale. This all needs to come together for a smooth operation. And that's critical. So it's all about people and then the financial, your expectations as a doctor, what you think you should be paid. It's a very different expectation when you're working with your two hands, all right? You have to realize that what's a reasonable return for your expertise in care. If you're the only one providing the care, it's a very different expectation. So you might need a higher fee to be able to supplement the difference of patients. When you have more people working, all right, you don't have to get the higher fee every single time. You still have to have quality of care. You still have to have relationships. All those other things still occur. So there's really no secret sauce to this. It's all about taking care of everyone that walks into your office appropriately. I don't consider the masses versus the boutique. I think it's a little bit too elitist. And I think there's a place for it. I think there's a definite place in society to have it. But the reality is that I would rather have my patients coming in the numbers are coming in and providing quality care rather than running after the next patient. It's an easier model to follow, in my opinion.
Thank you for that. And we'll just switch it straight over to you, Carolina. Is your model necessary?
Well, I mean, put that way, the answer is no.
No, it's yes.
No. Let me just go into that. I was like, I was overwhelmed by the way the question was asked. But yes, I mean, it is not necessary in the sense that is a Mercedes necessary. So if you look at Mercedes and Toyota Corolla, which one would be necessary? Considering that the car is a necessary item for the family, I would say the Toyota Corolla should exist no matter what, and the Mercedes can come later. So if the Toyota exists and whoever needs to drive a car, whether they are in the 1% or not, can drive a car. If only the Mercedes exists, the 90% or whoever is in the lower layers cannot have a car. So if you want to make dentistry accessible to all, of course, either there is a social system within the country that allows people to go there, or an insurance system that allows people that are insured to go there, or it's not possible. It's healthcare. In the other hand, the model, I mean, I loved the model I had. I succeeded at it beyond anything I could have imagined. But if one of the two had to be eradicated, I mean, just like that, even more with the person I became today, I would say it would have to be my model. I mean, to call it, it's not my model, but it was, you know, that model would have to be eradicated for the well-being of the majority, because you want to serve the majority. But if you take all of Rick's patients and they win Lotto tomorrow, and you say to them, now, which practice do you want to go to? I'm sorry, 90% will go to deluxe dentistry. Why? Because it's a dream. Why? Because it's a different journey. No matter, and I'm not judging how good the journey is. I know you, I know how you work, I know you do good work, but it's a different journey because you have to focus on productivity. One of the things I did not do, which was maybe a flaw, we will talk about it later, maybe, is that I did not focus on productivity. I only focused on the journey. Of course, I wasn't the spiritual person that I'm now, so I was also focusing on my journey. So not only the patient's journey, my journey was a dream, just like their journey was a dream. And there is not 1 year. I left private dentistry 6 years ago. There is not 1 year that goes by without at least 3-4 emails from patients saying, we never found a practice like yours. They're not saying a dentist like you. They're saying a practice like yours. It's about the whole journey. But the car that is more necessary is the Toyota Corolla, just like you don't need Louis Vuitton or Chanel, and that's why you don't have it in Africa, you know? I mean, because the other one is necessary, that's why I went to Africa and I created a nonprofit. Maybe it was my way of healing a little bit the guilt side of having been serving the 1%, or it was my way of really giving back at opposite ends of the spectrum. And I enjoyed it immensely. You know, yeah. So it's not necessary. But it's beautiful to have.